It's now my pleasure to introduce the incoming president of the Texas Medical Association, Dr. Doug Curran of Athens, Texas. Doug is a practicing family physician with East Texas Medical Center and Lakeland Medical Associates in Athens. He graduated from the University of Arkansas for Medical Sciences in 1976, completed his residency at Southwestern Medical School Family Medicine Residency Program at John Peter Smith Hospital, and is a fellow of the American Academy of Family Physicians. During his 42 years in medicine, he has become a recognized advocate for the patients and physicians of Texas. He played a leading role in the passage of Texas' groundbreaking liability reforms back in 2003. He fought for sweeping patients' rights reforms, including holding managed care companies accountable for their actions, championed legislation to improve the Children's Health Insurance Program and Medicaid, and fought attempts by non-physician practitioners to expand their scope of practice. As a caring physician and community leader, Dr. Curran is committed to improving access to quality health care for all Texans. He was instrumental in the creation of a rural health clinic and an obstetrical care clinic for patients with no means of payment, and through his participation in the statewide preceptorship program, he has helped foster the interest of the next generation of Texas physicians. Dr. Curran, will you please join me at the podium? It is my great honor to administer the oath of office to Dr. Douglas W. Curran. Dr. Curran, please raise your hand.
Yes, sir.
Do you solemnly swear that you will carry out the duties of the office of President of the Texas Medical Association to the best of your ability, that in all of your activities you will uphold the principles and policies of the association, that you will promote unity and cooperation among county medical societies and members of the association and with the Texas Medical Association Alliance, and that you will dedicate yourself and your office to accomplishing the association's primary mission, improving the health of all Texans?
Carlos, I accept these duties and obligations, and I pledge my best efforts for our profession and our patients. And that's yours.
Yep. Doug, it's a real privilege to present you with the President's pin of the Texas Medical Association.
Thanks, man.
See if I can do this without sticking myself.
That's right.
Pretty good with no glasses, right?
That's pretty good, man. I'm impressed.
Ladies and gentlemen, Douglas W. Curran, President of the Texas Medical Association.
Thank you. Thank you. Thank you, Carlos. Quite nice to you after you. Yeah. Thanks, guys. Yeah, I think it's going to be a lot of fun.
Congratulations.
Thank you, thank you, thank you. Thank you, Doctor. Well, I get to make my way down here because I'm going to move down a little closer to you where I can talk to you just a bit. I'm uncomfortable behind podiums and I'm a wanderer, so I'm going to come down here. And I've already had conversations with Carlos and with Lou and others, and I've been informed that my presidency starting off on the right foot. We're already having all kinds of screwed up messes and so forth. We don't have a system that works, and so just get ready. And I told them, look, that's family medicine. You know, we just take care of these people, whatever they are, and whatever disaster presents itself, we get in the game and we make it happen and make it work. I want to talk to you about a number of issues, and I got to be up front with you. I'm not an original thinker, so I got some of these ideas from other people. I got them from Kyle Henderson, from Bill Hybels, from GIST, a company that's in Washington. I had some ideas. I'm going to share these with you, but I want you to know you can find additional information in other places. And I think probably one of the first things I got to do, because they're so important to me, is family. And all my family is right here. And I'm talking about, you know, and now some of them are on the edge, you know. I mean, there's a hospital administrator over here and a couple others. But all these people are my family. So you guys all stand up so they know you're here, okay? And my staff, others are here. And I want to, it's a great group. Have a seat, have a seat. I want to talk with you about family in just a few minutes. But I want to begin the conversation with just thanking you for the chance to do this. You know, the Lone Star Caucus that believed in me when probably shouldn't have, but they did, and they empowered me, and, you know, Brad Holland and the group there have just been great. And then the other groups from all the different caucuses have embraced my experience and my opportunity to serve you, and I'm just really grateful for that. I am indeed like the turtle on the fence post. I didn't get there by myself, and I know that. And I need all your help, and I need your support as we begin this year, because there will be some disasters, there will be some trials. But what I want to really talk with you about a little bit is, to begin with, some people that empowered me that I think really believed. And I want to kind of start with my mom, you know, and you've probably heard me say this before. My mom told me when I was growing up, hey, get a nice clean job, be a doctor. Well, you know, your mother doesn't always tell you the truth, you know, because being a doctor is not a nice clean job, you know. So, but I ended up in the profession, and she believed I could do it for lots of other reasons as well. And my dad told me, you got to get your education, you got to do things, or you'll have to work most of your life using your back and what he called a scoop shovel, and he called it the ignorant stick. And he said, if you don't get your education, you'll be using that ignorant stick most of your life. And he said, that's an honorable way to make a living. There's nothing wrong with that, but you can get your education and make a difference. And then I had the privilege of practicing with this really special general surgeon in Athens, Texas. When I went there, Dr. Joed Smith. And we lost Dr. Smith about 9 months ago. But he was just this great guy. And you know, the best part about Dr. Smith, he was a magician with his hands. I saw him do all kinds of things. He gave me a piece of advice, which I still think is good. He said, when you don't know for sure what to do, don't pick up anything sharp. Is that right, David? I mean, in general, don't do that. So, you know, I got to operate with him for the better part of 14 years until Dan Pugh showed up and pushed me out the window. But it was okay. He needed Dan Pugh. It was much better. And, you know, but he was just this great guy. But the best part about Dr. Smith was not his magical surgical skills. It was who he was. It was his personality. It was his demeanor. It was amazing. Phenomenal. Now, I don't know about you guys, but I find myself in a world where there's a lot of negative stuff. I am really tired of all of the vicious behaviors that's out there. It seems like there's no graciousness anymore. There's no kindness. Where has it all gone? Where has our civility gone to? I am really concerned about that. And I want to call you out just a bit. And I want to challenge you, you know, to make a difference, to begin to look at that. And I want to give you some rules of respect I want you to look at. And we're going to start those in just a minute. But before I do, they're coming, okay? Yeah, my rules of respect, okay? I'm old, I can do this, I can tell you. But I think that it's really important that we just put into practice some basic stuff. And I'm going to tell you right now, if we're going to do this, I have to do it first. I have to set the example. If you're going to challenge people and call them out, you be prepared to do it. Doctor, you're going to talk to your patient about what they need to do. You need to get your act together too. I think it's really important. So 10 issues of respect. First one is set the example of how to differ without demonizing. And then, thank you. And second, encourage spirited conversations without drawing blood. And I think that's an appropriate medical term. Don't interrupt or dominate. Respect boundaries and watch your words. Be courteous in word and deed to everyone. Stereotyping because it hurts everyone, just don't do it. Apologize quickly when wrong. Listen and be willing to change. Show up when you say you will, and do what you say you will. And lastly, follow and enforce the rules of respect. I challenge us all to do that. If you go home and develop in your organization a civility policy, and you just say, we're going to follow some basic rules of respect, we're going to do that, you guys, we will change the world. We will change the world. Did anybody else watch that? Oh, man. I thought that was fantastic. But when all that was going on, there was this guy who loaded all the stuff in the boxes and all the equipment and packed all that stuff for those people who were involved in that, the girls that were involved in that, and they carried it over, and he did all the work. And he told them before they left, he said, if you guys win this, because there's no way you can win this, I will dye my beard pink. I challenge you, do what you say you will do. So you may see Doug Curran out with a pink mustache on a trip somewhere. So brace yourself, prepare yourself. I want to shift gears just a minute, and I want to talk to you about access to health care and issues in health care. I think, of course, that's where we're going to go. That's what we're going to talk about. But I got to tell you a story. My son, Chris he's a mover, a shaker, a real smooth guy, and you don't really realize that Chris is taking advantage of you until it's too late. Any of you have kids like that? I just thought maybe, he's smooth, okay? And but he called me up about 6 weeks ago when he was having trouble buying insurance for his family. And it was a struggle. I could tell from his voice, he was so frustrated by that. And I don't think Chris Curran's the only person out there that's frustrated by what's available in the insurance market these days. It is terrible. There's not enough options. There's not enough stuff. We got to change some of that. Some of that has to happen. And it's so frustrating. Any of you, all of you should be on Texas Medicine, which is the email we get all the time. If you got it about 2 or 3 days ago, you noticed there was a big article in the Houston Chronicle that said 4.5 million Texans have no health care. And 700,000 children have no access. They have no resources. They end up in the emergency rooms. They end up in just places that's not where they should be. What are we thinking? What's going on? Next slide. I want you to think with me just a minute about these areas, because I think they're most of the areas where health insurance comes from. They come from Medicare, Medicaid, employers, and insurers. And I'm here to tell you, I think what's going on in the healthcare system is a lot of what's going on in a lot of areas. If you look at what's happened, there was a day when we all had a retirement plan, and when we retired, retired with most of our salary still coming to us. But that's all gone now. We all got 401ks, and I don't know whether you look at the data, but there's not a whole lot of people who've still got an active 401k and hadn't borrowed against it and hadn't done all kinds of things to it. A lot of struggles out there. Nobody wants to make plans and do anything long term. And that's just true of health care. If you look at Medicare, Medicare is all about Medicare Advantage. I mean, the federal government doesn't want to fool with Medicare. Medicare's got the boomers coming. Who wants to do that? And so let's hand that baby off to somebody else. Let's give it to Medicare Advantage. And then they sure don't want anything to do with Medicaid, because we've got a lot of poor people in this country, and we've got to figure out what to do with them. So let's make Medicaid block grants, and let's do per capita caps. Let's do something to dump this baby in the state's lap. And the state says, hey, we don't want this thing either. We're going to hand this baby off to managed care. I've been dealing with a patient, and thank God for our TMA staff. I mean, they're just wonderful, you guys. You have no idea. Helen's been helping me. I have a child who is actively dying with vanishing white matter disorder. Some of you probably know what that is, but it's a bad thing, okay? And just trying to get this kid care has been really hard. And we've talked to the medical directors of different managed care companies, and everybody keep running around in circles. It's just really hard to get it done. But the handoff is it just keeps happening. Employers are the same way, and I'm an employer. I struggle with what I do with health insurance, and I'd like to hand it off to the insurance companies to manage it, and that's what we've done. And, ends up with high deductibles and everything else. All this is just so complicated. What are we going to do? And insurance companies, by the way, they don't want to do insurance anymore. They just want to manage your money. And they'll sure take their part of it as they manage it for you. And they'll limit access to patients and so forth. And then if you look at the next slide, there are a whole bunch of new players in our business. And the new players that are not listed on there are Berkshire Hathaway and Amazon are looking at stuff now too. But if you look at what's going on there, these are companies that are annual revenues in the billions over there on the far side. And you see pairing up of Cigna and Express Scripts and Aetna and CVS. Where do you think those people are going? They're going to have to make a profit. They got to produce things. And nobody wants to put more money in health care. It's going to be a struggle. And I know in Palestine, Texas now, which is about 30 miles south of me, the Walmart there has a clinic, a primary care clinic, and they offer a well-woman care for $100. And that's pap smear, blood work, exam. $100. Pretty good deal. And these companies can do that. Walmart can do to us what they did to pharmacy with $4 prescriptions, if they want to. If they want to put those kind of things in place, it can be a real struggle. I think with all this stuff that we've got floating around here, we got to figure out what to do. And I absolutely believe the thing we got to do is turn to our association. And we've got to use the tools that we have here. Now, I don't know whether you remember that movie, but in that particular movie, this gunslinger wanted a piece of Wyatt Earp. And Earp said, I'm not going to fight you. I don't even have a gun. And Doc Holliday said, I'm your Huckleberry. I need docs out there who can be a Huckleberry. If you know your legislator, if you know insurance people, if you know folks that are available that we can use, step up. Come on, we need you. Build relationships. If you don't have them, go make them. Figure out how you can get to know somebody that can take us to the next level, that can help us get there and understand that, listen, it's all about our patients. When we're taking good care of our patients, we're taking great care of ourselves. We got to continue to do that. You have to decide how much you will do and how much you won't do, and you have to decide how much you can stomach. There just comes a time you just can't do it. And it's okay. You have to look at your family. You have to look at your time. You have to look at what you can do. But that's why we're an association. We can all come together and we can do good things together. Now I want to switch over and talk just a second about families, and I'm done. I told you I got this wonderful family down here. Well, I want to start by talking about my personal family. And I'll begin with a conversation about Courtney. Courtney, when she was about 10 or 11, she wrote this really wonderful poem. We've been so blessed. Both of our kids are adopted kids. And we literally could not have made kids this good. They are the best of the best. And I told them that all the time. I said, it's just another way to get kids. So she wrote this poem, said, adoption, it's the other option. Or it's another option. And at the end of it, she talked about how valuable she was. She felt like at the end of that poem, I can't read it to you, I couldn't function afterwards, but she said that my parents see me as valuable as pure gold. And that's right. Now probably a long time ago, Chris was probably 10, he comes up with this Father's Day treasure for me, and it's a pair of gloves. And he gives me this pair of gloves, and he fixed me up this card, and I open the card up, and it says, Dad, you can never find two gloves that match up or fit together when we're working together. So I got you these two gloves, but I really got you these two gloves because they fit together just perfectly, just like me and you. Yeah, I know. I couldn't function for a while after that either, And then just recently, my wife and I went to the 50th class reunion for my high school. I'm telling you, I'm ancient, okay? But I'm not dead yet. I got a lot of go power, okay? And but we went to my 50th class reunion, and we are there, and the best part about it, in no time, the most beautiful woman in the world was there. She was the most beautiful woman there. There was no question about it. She knew it, and I knew it. I mean, there was no competition. She was absolutely magnificent, and has been, and has put up with me all these years. I know you can't, I don't know how she did it either. I'm sure she's going to heaven, there's no doubt. But I also have this great family. We met on Monday night of this week, trying to decide what we're going to do with this crazy doc who's going to go away and be TMA president. And he's got all these expenses because I got the employees I got to pay for, I got all this other stuff. What are we going to do with this jerk, Well, we worked through all that. We have had so many meetings where we all get together and we sort out what we're going to do. And when we leave, I feel great about it. My 14 family docs that I work with, it's as good as it gets. And then, our hospital is transitioning from ETMC to UT. And we're in the process of that. On Tuesday night, our staff meets, and we're in the process of all that, and we're trying to sort all that out. That's my other family. And we're getting all that done, And, here we have this great experience called, TMA. And it's another family of mine. And I have just gotten to know all these people. I have built relationships with them. I mean, putting all this nonsense together, I told Steve, I want to try and do this. And he said, oh, piece of cake, everything's a piece of cake for Steve. So he gets in there and gets it done. Brent helps me, all these other people. I can just call on, it's just amazing. Martha made all kinds of things happen. We did appointments. There's so many people want to do things here, which is great, absolutely fantastic. And we worked on all that stuff, getting it all done. Oh, that's painful. Let me tell you guys, that's painful. But I got to tell you a quick story. Sandy and I go to Hawaii for a bank board meeting. And let me tell you guys, banks know much better how to do meetings than doctors, okay? Everybody's always telling me, you go to all these nice places, Doug. Yeah, but I don't do anything other than work. All I see is meeting rooms. I go from one meeting room to another meeting room to another meeting room. I've been doing that for a long time to get the opportunity to do this. And really the opportunity to serve you all and to make a difference for my patients. That's the real reason for this. But anyway, we went to Hawaii, and we're there a little bit out of whack with our timing. And so I woke up early. Sandy was still asleep. I decided I'd take a walk, down the road. It's foggy. I can't see very good. So I decided I'll exercise, over by the treadmills and stuff where they are. So I go over and get on a treadmill beside a guy on a stepper. And I said something to him. I'm your basic extrovert, so I begin a conversation. I get on the treadmill. And I've just gotten on the treadmill, and in comes this absolutely gorgeous woman. And she goes over and repositions the treadmill, changes the channel on the TV. And I'm looking around the room, and everybody is watching this lady. And I'm talking to the guy on the stepper, and we're just trucking along. And finally, I finish my exercise and everything, and I get off of the treadmill, and the guy gets off the stepper about the same time. And I turned around, and being the extrovert that I am, I said, I'm Doug Curran from Athens, Texas. And the guy grabs a hold of my hand, and he says, I'm Joe Montana from San Francisco. I said, oh my God, you're Joe Montana. I've hated you for years. And he said, oh, I understand. This guy's really a nice guy, And we just struck up a great conversation. And we're proceeding along as we're going out. And we go by this absolutely beautiful woman. And Montana goes over and says, hey, babe, take your time. Finish your exercise. I'll meet you in the room. It's his wife. Just thank God I didn't say anything. Could have died. Well, I want to tell you, I think we have a treasure around here. And I want to show you this guy, and I think he'll come up in just a second. It's called Lou Goodman. Lou Goodman's the guy on the stepper, okay? I don't think everybody knows that. Lou Goodman's the guy on the stepper. Everybody looks at this beautiful organization, and it's a magnificent piece of work, and everybody wants to be like Texas. Everybody, every medical association wishes they were like Texas. And Lou's been the real power behind that. He's been the guy on the stepper that we just kind of take for granted most of the time. And we chat with him as we go by, but sometimes I just want us to be sure that we're appreciating that. And as that staff member engages you in the different areas that you work and you function for this organization, tell them thank you. Tell them thank you. Now I want to conclude with a quick story again. You know, I don't know, Shelton Gross and I were talking about letters that we keep that keep us sane. Every now and then when it's a bad day, I'll get out with that little pack of letters. And I have a letter from I'm going to call this guy Dr. Green. He was a dentist that I began to take care of right after I came to Athens. And I saw him for the better part of 25 years probably. He had a stroke and died in his late 90s. And after he died, I got this letter from his daughter. And it said, Dr. Curran, thank you for taking care of my dad. I know during the last 10 years or so of his life, there wasn't much you could do to help him. But you know, when he left your office, he always felt better. You guys, let's go make our people feel better, and let's take great care of them. Thank you for this opportunity. I won't let you down. Thank you.